Welcome to Stand Up Upstate. I'm Amberly.
I'm Anna.
And we are going to be interviewing Vicki Ringer. And she is the Public Affairs Director for Planned Parenthood South Atlantic today. We're going to be talking about the bill that didn't pass.
Yes, the 323 that got to the South Carolina State House and found itself going nowhere.
Yes.
Today we are talking about bodily autonomy.
We are.
Abortion bans, and everything in between.
So first question I have for you is really just how did Planned Parenthood come about? Do you know the history? I guess, do you know the history of it?
I do. I do. Back in the early 1900s, Margaret Sanger, who does not have the best reputation, she has been known to be a racist. Well, she's dead now, so she's not known to be anything now. I don't know that she was a nurse midwife, but something along those lines. And what she saw was how many women in her New York neighborhood were dying from childbirth, particularly after having child after child after child, and without birth control. So she began educating women about how not to get pregnant. Of course, back in the day, you didn't have IUDs and hormonal pills and things like that. So I'm sure a lot of it was based on cycles.
Yeah.
But then other things started happening, diaphragms and barrier methods. Of course, no abortion at that point. It wasn't until 1973 when the Roe v. Wade case came about that Planned Parenthood started providing abortions. And of course, everybody thinks that's why we exist,
Yeah.
It is an important part of what we do because it's part of the full spectrum of reproductive health care. But it's not all we do. We started as a birth control organization, but it was in the 20s or 30s that the name changed to Planned Parenthood.
Okay.
And, it's still about Planned Parenthood.
Yeah.
It's helping people plan when to be parents.
Which is just good thoughts all around. But it's so interesting that Planned Parenthood's roots is in something other than what people think of when they think of the name Planned Parenthood. It's become sort of synonymous.
Yeah.
Oh,
with
of course.
The abortion factor. But the more it's so important that people know that the foundation, the base and its founding exists for other purposes. So
yes, we're everybody's favorite whipping boy, so to speak.
So what does sort of a normal day look like in your average Planned Parenthood office?
We set up at least in Columbia and Charleston, we provide family planning services and abortion care. And something that we provide that a lot of people don't know about is vasectomies.
Really?
And the eyes got big there. Yeah.
Nice to see some equal opportunity there.
Exactly. And the interesting thing is that Medicaid will cover vasectomy for men. And of course, men still get you're going to get close to my what with what?
Yeah.
And but they somehow don't mind women having major surgery to get their tubes tied, So it's not a fair system.
When you say family planning type services, what services fall under that? Obviously, vasectomies would fall under that.
They do. Mostly what we think of as our annual gynecologist appointment that we all go through. And it is birth control. It's IUD insertion. It's for some people, they have the implants. Some people get the birth control shots, so they come in for that. But it's also a lot of screenings for sexually transmitted infections. And that is all ages and all walks of life. And part of it is we have an expanded Medicaid. And then there are a lot of patients that we do their check their sugar, their blood pressure. We do counseling and referrals for depression and anxiety. But mostly everything is around anything to do with your reproductive organs is what we do. So breast exams and we do testicular exams for men because that's a thing. Men get breast cancer.
Yeah.
So I feel like we need to make a point to not understate the fact that Planned Parenthood and the work that they do does save lives.
Precisely, it does.
Yeah.
Absolutely. South Carolina has some of the worst rates of STIs in the country.
Really?
Yes. And in fact, it's the fastest growing state for the spread of syphilis. Now, who thought syphilis was still a thing?
Yeah.
But it is. And we work with a lot of doctors. They've been very generous with their time to come to the State House and talk to legislators about what they do and why these bills don't work, because medicine is nuanced.
Yeah.
You cannot legislate for every scenario. And what is completely fine in 1 minute can turn to a tragedy within seconds.
Yeah.
Doctors have the experience, skills, training, education to do this, but our laws tie their hands because the men in the legislature think they know what's best. And in Tuesday's hearing, one of the senators, Billy Garrett from Greenwood, said women are killing their children. Now, I don't know anybody who would think about a first trimester abortion as you're killing a child. He does, apparently, but if there's any doubt, walk into an IVF clinic and check out what's in a petri dish. And you've got your 2-year-old here in a petri dish here, and the fire breaks out. Which one are you going to save?
Yeah.
You can only save one.
Yeah.
You going to save the petri dish, the embryo in that, or are you going to save the 2-year-old?
Yeah.
Yeah, that was in fact one of the broader problems with the with 323. That was that it opens that door to also limiting IVF. Like the bill was so restrictive and so willing to stop abortions altogether with it that it really failed to consider and take a look at a myriad of other consequences up to and including IVF, which in its best work creates life.
Absolutely. What they believe is because those embryos that aren't used right away are frozen. And they believe that that's torturing a child.
Oh.
So any embryo that is created must be immediately implanted. So if you're going through IVF, you're also trying to make multiple embryos so that you can get one very healthy one out of it.
Yeah.
And whether it's viable or not, they test those to determine which ones are the healthiest and the strongest.
You parse it out and look at where that thought will take you.
Right.
Just saying it and not realizing how that plays out down the line. You're like, oh yeah, that sounds reasonable. Well, what does that actually look like? Let's take a look at how that works.
Well, it definitely shortens any provision for the health of the mother, which was yet another problem with this bill, is that it removed all of the caveats.
And there's a lot of birth control methods that even can stop your periods.
Yeah.
And there are other people who've gotten pregnant on birth control that continue to spot. And they think that's their period. And we are trying to legislate what is right for everybody when everybody is different. The miscarriage rate is pretty high in this country. It's about 40%. So
Ooh, wow.
I know it's
I did
pretty low.
not know it was that
I
high.
had always heard like
Yeah.
25, actually. But
Yeah,
no,
well,
that's
and
not surprising because it's not something that we talk about. It's not
yeah.
something that women discuss amongst each other for the most part.
No, because it's usually painful.
Yeah.
Well, I don't want to scare people because
Yeah.
when I'm
sure.
talking about miscarriage, this is even before people know they're pregnant.
Yeah.
So
Mhm.
this would be uh, eggs that don't implant or that may implant, but they don't stay implanted.
Yeah.
But, we've got legislators who are trying to um, make a fertilized egg a person.
Right.
And so if we are passing a fertilized egg and it's never implanting, am I guilty of murder
Yeah.
because it didn't implant? Did I not take the right vitamins or eat the right foods, or did I exercise too much? No one would ever say that about me.
Yeah.
But there are people who are active. Did I
Or
ride on the
your
back of a
uterus is the wrong shape.
motorcycle?
Yeah. Well,
The shape of your uterus makes an impact too. So
Yes,
then
it
are you going
does.
to criminalize me because I can't help how my body is shaped?
Of course. Yes.
Yeah.
I mean, they're punishing women for things that they can't control.
Yeah. I can't
Yes,
always control if I
You
miscarriage.
can't control a tilted uterus.
Yeah.
exactly.
Yeah.
And you can't control what implants and what doesn't, and you can't
Yeah.
control, what genetic abnormalities are going to pop up that's
Yeah.
going to cause
Your body to naturally
take care of things
Because
on their own, because that's how it's built to work.
it is.
Yeah.
Which again comes back to the fact that laws are being made by people who don't understand the ins and outs of the female body.
Exactly. Exactly. Nor do they listen to doctors about it. They have their group of doctors, which are the Association of Pro-Life OBGYNs.
Mhm.
And
Yeah.
there's some interesting people in that group. It's a very small group as
Mhm.
compared to the American College of
Yeah.
Obstetricians and Gynecologists,
Right.
Yeah.
The
who are
broader.
trained to keep you alive. Um, they believe that there's no situation that would require an abortion to save a woman's life. What they mean by that is that no matter how far along you are, in case of that woman, when she was at 5 weeks or when she was
Yeah.
at 20 weeks, they would have demanded that she have a C-section or induced labor and delivery at 20 weeks, which a C-section is major surgery.
Yeah.
And
Yes. Major recovery.
and at 20 weeks, there's no viability. There's no fetus that can survive at 20 weeks. They want, instead of an abortion, they want you to give birth, even if it can't live. And no matter how far along you are, you've got to give birth. You can't do an abortion.
So we're putting
There's a difference. Yeah.
Yeah.
we're putting women through a difficult physical situation after
Yeah.
being put in a difficult emotional situation.
Of
And
course.
compounding that emotional situation because could you imagine having to give birth knowing it's not viable? I've had a friend who has gone through that and it wrecked her. I mean, and there was nothing she could do. But
It is. It is.
very hard, very hard.
Because like everybody around you, there's an expectation, especially once you're showing that, hey, how's the baby? Like you don't know
When are
what
you
you're
due?
you don't
Can
know
I
what you're
touch
stepping
your
into.
belly?
It's such a difficult time.
Well, and people want to celebrate life
Yes.
too, so they see that and it brings joy to a lot of
Yep.
people, and so yeah,
It definitely happens, and it is unfortunate. So
it is
Well,
very
especially
unfortunate.
if you already have children
Yeah.
and they think, well, there's a baby in mommy's belly.
Yeah,
And, explaining to a child that that baby has died, that can be traumatic,
Yeah.
very traumatic.
Yeah.
for all
But I've
parties.
seen this with quite a few friends who have had to travel out of state when they've gotten a diagnosis that says nothing you did nothing you can do can make you come out of this with a living baby.
Yeah.
And there's supposed to be an exception for that in the 6-week ban for fatal fetal anomalies.
Yeah.
The problem is if a doctor can go to jail, can lose their freedom, lose their financial ability to support their family, lose their practice and their medical license, they're going to err on the side of caution.
Yeah.
In some situations, you can say, well, 99 out of 100 times, this will cause death immediately upon birth.
Yeah.
But that one time, it might have survived 2 hours.
Yeah.
So is that fatal or not fatal?
Yeah, it doesn't make those numbers. It doesn't make those same numbers.
Yeah.
And it changes the dynamic a little bit.
And it makes them hesitate about things that they shouldn't have to hesitate about.
Yeah.
And one of the senators said Tuesday that that's why hospitals had lawyers. No, that's not what should dictate our care.
No. Nope. Not at all.
That should not be that should not be the focus of,
Exactly.
well, that's fine. Just let them sue us.
Yeah.
It should not be the way that anybody does business about anything.
Or that a
No.
doctor has to call a lawyer first to say, all right, this is what her vitals are. This is her situation. Can I safely give her an abortion to keep her alive? Well, no, you really need to wait until her temperature goes up to this and she's septic and her organs start shutting down, and then you can do it.
Well, and it's like you said earlier, things can change in a matter of minutes.
Yeah.
Everything goes from fine to not fine very quickly, and to having to find the time to call lawyers, just not adding to that.
Well, and lawyers didn't go to medical school. I mean, so really they're making a judgment based on protecting their client. That's what a lawyer's job is to protect their client. Well, who's their client? It's either the doctor or the hospital.
Yes.
So they're going to err on the side of protecting them versus the woman whose life is at risk.
Yes, who's protecting the patient.
Yeah.
Yep.
No one in that scenario.
So all of this, though, has caused some consequences in the amount of doctors that are being trained.
There's been drops in residency applications by 5.7%. That means that we aren't having people come to our state to do their residencies, which means, you can get doctors to stay sometimes. They're doing a residency someplace. And we have 13% of our counties are classified as maternity care. They're deserts.
Absolutely.
Which means there's no OBs, there's no midwives, and there's no prenatal care. So even the women who want to have a family, they aren't getting the care they need. They cannot adequately take care of themselves in a way that will help them and benefit them and their families.
Yeah, we have 15 counties right now with no OBGYNs at all. And there are quite a few more that just have one. I think the numbers are, it's roughly one OBGYN to 3,000 women of reproductive age. And yes, we're losing doctors. One of the residents told me that the numbers are people who go to medical school here and or do a residency here, 75% of them would stay in state because they've gotten used to it. They've learned the system here, and they came here because they like the state, the climate, whatever. That's not the case anymore. People aren't coming here to train because of the restrictive abortion law. And not just for abortion, but knowing that I could have a patient dying, and if I can go to jail for this, what's going to be next? So it's not just OBGYNs that are refusing to come. There are orthopedic surgeons, cardiac doctors, because they have families. A physician recruiter at one of the hospitals here told me, she called me some time ago and she said, Vicki, you need to quit talking about this because it's hard getting doctors to come. I said, you know what y'all need to do is y'all need to call the legislator
Yeah.
and tell them that. Don't tell me. I'm not going to quit talking about it.
Yeah.
Don't make a fuss
Yeah.
at them.
Yes.
And then we have stats that say that 94.4% of pregnancy related deaths can be prevented.
Absolutely.
That's 94 families that didn't have to lose a loved one.
Yeah. And we're
Out of
already
every
8th
100.
highest maternal mortality rate in the country.
So I want to pivot and because I want to kind of touch all the points that this bill was gonna slash. One of those was contraceptions, and they were targeting very specific ones. But people use contraceptions specifically. I know for a fact birth control pills, and I'm sure you can tell us the others, but for things other than preventing pregnancy.
Precisely.
So
Yeah.
can you tell us some of the things that birth control, or even, because I don't know a whole lot about the implant or anything else, what a woman might have those or take those for?
Yeah. Let me start with what it said in the bill.
Yes, please.
Because Richard Cash made a big deal about saying this does not ban birth control, but he put a definition in there that said contraceptives prevent ovulation. Well, there are a lot of ways that contraceptives work. And in fact, most of them work in multiple ways. It's like a backup plan. Even birth control pills, we think of those as just hormonal. They can prevent ovulation. They can also make it difficult for a sperm to penetrate the cervix and move up into a fallopian tube. And it can also make the uterus lining thinner so that implantation is difficult. So there are a lot of birth control methods that work in all three ways.
Okay.
So it's not just preventing ovulation. And there are birth control pills, rings, patches. There are implants in the arm. There are hormonal shots that you can get once every 3 months. There are IUDs, and there are two different kinds of IUDs. There are hormonal IUDs and a copper IUD. The copper IUD does work without hormones by making it so that an egg can't implant. But hormonal does both. It would stop ovulation and it also prevents implantation. So, when you change the definition of what a contraceptive is, Richard Cash knows full well what he's doing. The anti-abortion crowd believes that all birth control is an abortifacient. They think all of it causes an abortion.
Interesting.
Birth control prevents a pregnancy. Abortifacient ends a pregnancy. They're not the same. Not the same at all.
No, so it's a fallacy. It doesn't, they're sort of matching definitions to meet their needs. So
yes, absolutely. And another one is the emergency contraception, or what we call Plan B, that you can use within ideally the next day, but within 72 hours or 3 days of unprotected sex. And it is nothing but a higher dose of estrogen, progesterone that are in hormonal birth controls to prevent ovulation. Because what we know is that sperm can live for quite a few days.
Yeah.
And this is why that window of when you can get pregnant is bigger.
Yeah.
And so that emergency contraception prevents you from ovulating after the fact. If you take it and you're already pregnant, it will not do a thing. It won't end a pregnancy. It won't do anything.
We're not doing any
You're just
damage.
out $30. Yeah.
Yeah. Okay, so what are some common uses for contraceptives that don't
Other than.
other
Yes,
than
yes.
preventing pregnancy?
One of the most common is those who have very difficult periods.
Okay.
And I've seen this with a lot of young people that have debilitating cramps,
Yeah.
headaches. I think it is, I want to say 40, I'm using 40% again, of
Mhm.
people miss a day of work or a day of school each month, either
Wow.
because of pain or because they can't afford hygiene products to allow them to go to work or go to school. Because SNAP program doesn't pay for that. They're very expensive.
Yeah.
And, it's kind of something we take for granted. But until last year, thanks to Katrina Shealy, that they ran out of the Senate, there is no longer a sales tax on those products. So that's a little bit of a savings.
That is helpful. Yeah.
But that's a big thing. I think that's probably the most common is a difficult period. Another very common reason is polycystic ovarian syndrome.
Yeah.
And
PCOS.
that is very painful and it can be paralyzing.
Yeah.
And birth control, as people have told me, allows me to live my life.
Well, we are down to our last couple of minutes with you, and we'll let you have your evening back here. Do you have any parting words for us? Anything you want to get out there before we let you go?
I think the biggest thing for folks in South Carolina to know is that 323 died because of pressure from the public. And so often we don't feel like we're making a dent. I hear it all the time. Why should I vote? I'm one blue dot in a state of red, or my vote's never made a difference, or I can call Lindsey Graham all day long and he never listens to me. But this is the time when people calling their state senators really paid off and the pressure worked. And so let that be a reminder to everyone that your voice matters. Even if that senator says, well, I don't agree with you, they are keeping count of how many people called. And so at some point he's going to say, well, I don't agree with them, but I'm not going to impose the death penalty on these women who have abortions, So maybe some feelings are tempered. And I would say always make sure you call your legislator, even if he tells you to go to hell. Keep calling every day,
Keep doing it.
It matters. And it works.
Your voice heard.
Yeah.
Make the call.
Our thanks again to Vicki Ringer, the Public Affairs Director for Planned Parenthood South Atlantic, for joining us this evening.
Yeah. And so our plan of action for this episode is to call your state senators and representatives and let them know that you are glad that S323 did not pass and that you will be continuing to monitor and watch for anything they might be putting up. Your voice does matter and you need to use it.
Thank you for joining us. Stand up, Upstate.